Hi, I'm Dr. Joanne McDonald with Dalhousie University and the Reproductive Mental Health Service in Halifax, Nova Scotia, Canada. This is one in a series of educational videos that we prepared on topics in maternal mental health and the development of mothers and young children from an emotional perspective, and in particular, the Mother's Mental Health Toolkit project. This toolkit project involves the creation of a resource, the so-called toolkit, for use with community service providers. The following presentation is going to be an introduction to the use of this toolkit. So just to familiarize you with who's been on the Mother's Mental Health Toolkit project team, it's myself as a psychiatrist and project lead. We have Colleen Flynn as a social work clinician who's also been very involved in training development and content development of the toolkit and is the co-developer of the Mother's Mental Health Toolkit. Tana Woodward has also assisted us as an experienced mental health clinician in the development of the associated training materials, and Kim D'Ambrosi has been our administrative and project assistant and coordinator. What's reproductive mental health, and in particular, what's a reproductive mental health service? Well, what we do is that we provide comprehensive mental health care and assessment for mothers. In our center, we particularly focus on women in pregnancy and in the first year after their baby is born. We're a typical interdisciplinary mental health team, as there are many community mental health teams in North America, and that includes medicine and psychiatry, social work, clinicians, nursing, psychology, occupational therapy, addictions counselors, and other types of mental health professionals who may be able to assist mothers and young families. We tend to have a particular focus on community collaboration, and we're very proud that this project is actually an example of that. We're very involved and active in professional education, but also in community education of just persons living in our town and our area, of mothers, fathers, young families, and the service providers who try to support those young families. This particular project was funded by the Public Health Agency of Canada, which has a commitment to the healthy development of children and their families. And through the National Projects Fund, we've been fortunate to be able to fund it to create the toolkit resource and the associated training materials. Who is the toolkit intended for? Well, the primary audience is a particular group of Canadian service providers, which are called CAPC or CPNP projects, and they tend to focus on nutrition and food education and preparation for young families, as well as the development of young children in a broad sense, but including their emotional and their brain development. But we also hope that the toolkit resource and the associated training materials will be made available and be applicable to the work of any frontline service provider working with mothers. Not exclusively in pregnancy or the first year postpartum, but certainly mothers of children from 0 to 5. So what's in the toolkit? Well, it's really maternal mental health education at a broad level. It also includes active worksheets that you would use with a mother or that a mother might complete on her own to sort of get her thinking about her mental wellness, get her thinking about whether there are any particular risk factors for her, what she can do to protect herself, or if there are particular elements of illness, such as postpartum depression, that might be coming in her situation. We tried to have a focus in the toolkit resource from wellness to illness recognition, and include resources that could be useful generally and broader areas of sort of reading and research for those that were interested for mothers and their caregivers, both caregivers within their family and also professional and community support and caregivers. What it's not is intended as a professional education in any way. It's not intended for mental health specialists. It's really targeted at the level of what the average community member working with young families would want to know about maternal mental health and its importance. Well, we recognize that this is a very basic template of a resource. It does not have a depth of diversity applications, but we hope that we've developed it in a basic enough and sort of simple enough way that it will be able to be sort of, particularly modeled to the needs of your community or your particular mothering population. It does not have cultural specificity, rather deliberately, because again, we wanted it to be a kind of basic resource for all Canadians. It is not a replacement in any way for mental health intervention, for specific mental health assessment, or for treatment in any way. Because of the particular challenges in rural and truly remote areas of Canada, we also know that some of the advice or some of the examples in the toolkit may not be readily applicable to those particular geographic or community realities. But again, we're hopeful that staff who will use the resource will pick and choose from the materials in it what seems to be useful to them and what also might be able to be adapted in some way to be used in their community. It is not at this time translated into any other languages other than English and French as the two official languages of Canada, but again, that may be a future adaptation. And again, it's never a replacement for mental health services, in particular for treatment, and particularly if there are any urgent or emergency features in the mother's presentation. What's the project timeline? Well, it was begun in January of 2012, and we hope to be completed of the creation of the resource and the associated training modules in December of 2013. Some dissemination of the resource and some experiences in training, both at the in-person level and indirect training, such as perhaps you watching this video today, we hope will continue beyond 2013. And a lot of effort has gone into trying to consider ways to make the resource sustainable over the next number of years. There have been 3 phases to the project itself. The first has been the toolkit itself has been revised and given national applicability, we hope, from its origins in Atlantic Canada. We've been very busy developing a variety of training modalities for various settings and individuals and hope that you'll be able to sample a few of these. And then the third will be the dissemination of the resource nationally across Canada and planning and preparation for training delivery, both in person and remote access opportunities such as video as you're watching today. We thought it was important to talk a little bit at the start about what are the project values. What were the things that we thought we wanted to come through in the toolkit and in the training modalities that would sort of reflect the work that we do with young mothers. Well, we wanted it to be health promoting and not really about illness specifically. We wanted it to be an example of mental health literacy from a specialty team like ourselves to the broadest base in the community. We wanted it to be community informed, and so we've been very careful from its very beginnings to partner actively with our community service providers here in Halifax and now across the country to make sure that the materials and the examples are relevant to the real life experience of Canadian mothers in a variety of settings. It's family centered in the sense that although the focus is on mothers, it's not exclusively concerned with sort of the mental health or the needs of mothers, but we feel is very connected from the healthy mother to the healthy child and ultimately to the family unit. As we know, many of our families vary in composition in this time. We may have single parents, we may have parents that are in blended families with children from a variety of backgrounds and origins in terms of their current involvement in the family. And many families have a lot of involvement with their elders and with other important persons in the community who may not be biological relatives, but are very much considered to be part of their family unit. So we've tried to develop it with this in mind. It is a strengths-based document and a strengths-based ethos in terms of what we hope to see. We want to see, we believe strongly that mothers want to be the best they can be for themselves and for their children despite their challenges, and even in the most difficult circumstances we're looking to begin from what those strengths of that individual mother might be and how we can capitalize on those. It is support enhancing in terms of the role, particularly of community service providers, and they're very important to share the knowledge broadly in our communities and with many different professionals and support providers, both formal and informal. And ultimately, it's an example, we hope, of a beginning initiative from especially medical team towards collaborative care and intervention in innovative and creative ways in our communities. So I'd ask you to stop for a minute and think a little bit before we go on to describe the toolkit, how it's organized, what the sections are, what the focus is, to think about what are your values when you work with mothers. Are they similar to what we've outlined in the project, or would you add other adjectives or other ideas to this whole notion of value? Well, one of the things that we start with often when we think about developing a resource is what are the elements of vulnerability, particularly for maternal mental health problems? Well, some of you will recognize from these photos that these are the very familiar social determinants of health, which we know have a great deal to do with challenges to wellness and onset of illness, as well as access to treatment and interventions. These are things like where we live, what kind of housing we have. There are biological elements like our family of origin in the black and white photo. And really critically often in many of our most at-risk communities and families are the elements that have to do with poverty and isolation. So what are some of the vulnerability and risk determinants? Well, certainly poverty in the broadest sense, but particularly financial disadvantage relative to others in our communities, low levels of support at a personal level and at a sort of service level in some challenged communities, a history of family conflict or disruption, which may be sort of continued into the current life of the family that you're working with, prior trauma or even ongoing trauma at a community level and certainly at a personal level. And this can be trauma of many different sorts, physical, emotional, sexual, and at a community basis. So when you live in a community where there's a lot of risk of violence, a lot of risk of difficulty just getting from one place to the other safely, these are elements of ongoing trauma. Poor housing, we know, is associated with poor health outcomes, as are transportation limitations. Deficits in education have a very direct connection for women, particularly to their income level and their employability. And many people still in our country are unemployed or underemployed, and this is particularly true of women who are parenting young children. A previous mental health problem, particularly if it's a defined illness, certainly predisposes and creates vulnerability in a particular woman. So also does a family history of mental illness or addictions. Doesn't mean that you're going to repeat exactly the experience of your family members, but it does mean that this confers probably a kind of higher biological risk. So it's something we pay attention to when we're thinking about developing resources and when we're working with individual women and their families. Well, it's a bit like, talking to people that are already convinced probably if you're watching this video, but we believe strongly that promoting mothers' mental health really is that connection between the well mother, the healthy child, and then ultimately stronger communities, because healthy children go on to be highly functioning and cooperative, productive adults. One of the things that we are very much aware of as we do this work is the critical involvement of infant attachment and development with primary caregivers, such as their mother, and their ultimate sort of development, both physically, certainly in terms of emotional control, social capacity and understanding, as well as their actual sort of brain power in terms of thinking and learning and speaking. We know that certain aspects of infant attachment and development can be one of the important contributors to a risk of childhood mental illness and behavior problems. And in our country, as in many other areas, this is a growing problem as to how we address early on, what are the important and effective early intervention models to help young children on a more productive and smoother developmental path in terms of their emotional and mental life. Now, photo of this young, defiant young man, you know, is one that we're all probably familiar with if we've parented or worked with young children. And really, this sense of frustration and no, I don't want to do it is inherent in all of us as human beings. So what are, you know, we're thinking about this and the factors of what are the kinds of things we can do as a community to really make sure that this is a developmental phase for this boy and doesn't go on to be his stance and position in terms of his involvement with his community later in life. What are some of the things we see as maternal mental health problems? Well, some women come into pregnancy with a pre-existing diagnosis. They may have had major depressive disorder with recurrent episodes over their teens and early 20s before their first pregnancy. They may have an illness like bipolar disorder or social phobia. Or they may develop a new mental health problem during pregnancy or in that first year or so after a baby is born. Some people say that the first year postpartum after a baby is born is the highest one-year period of risk of new mental illness for women in their entire lifetime. So it's part of why we really watch and are particularly focused on early identification of problems, the promotion of mental wellness, and sort of early intervention models in general. We see in our clinical service women who have any kind of severe adjustment difficulty. Just because an emotional reaction is expected, so for instance, if when you deliver your first baby, you lose a family member in a car accident and your husband loses his job, and you find out that your older child has a major health problem, most of us would be stressed, we would have distress, we might even have difficulty sleeping, be tearful, have the kinds of things that we think of potentially as symptoms of mental illness. So even if it's a known reaction to a severe stressor, it's still very important that that woman receive particular support and that she have proper intervention and treatment because repeated incidents of severe adjustment difficulty or severe stress really create the ground sometimes for the emergence of actual illness. We see women with difficulties that are known as personality disorders, and really this is just a kind of a label or a name in medicine for people who have particular recurring patterns in their relationships that create difficulty for themselves and for the people they're in relationships with in terms of how they cope and how they relate to others. Again, our focus is on a strengths-based approach, helping that woman recognize where there are limitations or difficulties and helping her move beyond that to really function and flourish more in her life. We see a number of women who come with post-traumatic stress disorder spectrum, and this again can be everything from past trauma that becomes sort of reawakened under the circumstances of delivery of a child or the stresses of early parenting, including the typical sleep deprivation that many young parents experience. It can also be related to recent trauma, again, of many different sorts, and even the pregnancy, if there are complications or the delivery becomes very, very difficult and there's threat to the mother or to the baby, can be considered a trauma sort of in itself. And we know in trauma work that early intervention to normalize the woman's experience and function and help her understand it and integrate it into her life ongoing in a way that doesn't continue to sort of have those traumatic elements recurrent is really important to long-term mental health. We tend to work with our addictions colleagues for women who present in pregnancy or in early mothering with concurrent addiction risk or with affected others sort of in their family unit. Attachment disturbances we sometimes also work with as well when they're severe and when they seem to be particularly difficult to overcome. And we look at a lot of support in cases where there are a number of complex factors, so multiple things happening at once. A woman ticking off many different kinds of risk factors, both social, personal in terms of her own background, and perhaps biological. We know that women who go on to have medical complications that involve a lot of sleep disruption, a lot of pain experience, have higher rates, for instance, of postpartum mood disorders. Well, who would we use this toolkit for? Well, I want to give you a little case vignette that is a composite of the kind of young woman that we might work with. And please understand that these details are compiled. They're not of any particular person. The names are not the accurate names of any particular patient in past or current treatment. So a typical case would be Jody. She's 19 years old. She has a biracial ethnic background, Caucasian and African Nova Scotian by her own identification. She's a pharmacy student, though on scholarship, has come out of her high school with a lot of promise, despite that she's parenting 1- and 3-year-old girls currently. Her ex-partner is said to be a drug dealer, and she describes him as currently threatening and manipulative, particularly around visitation and child custody with her older child. She lives in public housing in Nova Scotia with her 4-year-old sister, her mother, and her own 2 children. Her mother has a history of what we would broadly describe as emotional dysregulation. She can become quickly angry, quickly anxious, very reactive woman, very connected and supportive of our young mother, Jody, but with her own history of both the experience of violence as a victim of violence and also experience of violence towards others, particularly other women in her community. Her biological father is an African American who left the family unit when she was less than 3 years old, and she has had some contact with him, but quite a bit of contact actually with her paternal grandfather and her maternal relatives, her paternal female relatives in the United States. Her younger brother has a history of difficulties with, again, emotional regulation and behavioral control. He has been physically violent, directly and also threatening of same to both Jody and her mother, and was incarcerated at the time that she came into care with us because of his involvement in theft and in violence in the community. She has a history when she was about 10 years of age of a period of sort of obsessional, recurrent thinking, worrisome thinking that we call rumination, like a thought you can't get off your mind. People say like gum on your shoe. And she would count when she became anxious. Just count randomly, count things in the room, count in her head as a way to sort of self-soothe and calm herself. And she would revert back to that counting tendency at times of stress. But, really this was something that presented in her childhood and largely settled into her teens. We would say she had a baseline kind of anxious temperament as a child and teenager. She'd see herself as being a generalized warrior. And when that is at a level that it interferes with function, we call that GAD, or generalized anxiety disorder. She came to see us on referral from her family doctor after her last child was born because she said she had the new experience of becoming suddenly explosive and then angry, mostly verbally, but sometimes physically with objects in the household. She didn't understand really what would trigger this initially, and she would feel very depressed, very down and withdrawn sort of after this sort of surge of energy and anger. So this is a typical kind of multi-determined kind of presentation. Does she have current mental illness? We're not really sure. That was part of the focus of our assessment. Is it something that she's adjusting to in her situation? As you can think, it would be very challenging. She has young children. She's starting a demanding university program. She has to travel a great distance. And she's living in adequate but challenged neighborhood and public housing. So here's our Mother's Mental Health Toolkit. And as you can see, we call it a resource for the community. It was co-developed by myself and Colleen Flynn, a clinical social work therapist on our team. So how is the toolkit organized? Well, this is our table of contents page, and you'll see that there are an introduction and a rationale for the kind of development of this resource. Then you'll see it's organized in a number of different ways, a number of different chapters. So we have mother's wellness and self-care, the mothering role, understanding mother's mental health. Then we go on to assessment and screening, some discussion of interventions and treatments, what they are, what they're not, what a service provider would need to know if they're working with a woman who may be seeking treatment or is involved in treatment with the formal mental health system, how we support recovery generally, and what some examples of community action are with our partners in CAPC and CPMP projects. Then you'll see there's an appendix that has resource lists and literature references, and an area for you to log local resources, and a feedback form. So again, if we look at how it's organized by chapters, and you have a table of contents, but you also have the chapters identified, as you can see on this slide, by color and by number. And you'll see that there's a tab that goes down the right-hand side of the page that you'll begin as you use the toolkit to realize, oh, that's in section 3, that's the red one, and you'll be able to go to it sort of quickly. And the tabs on each side indicate whether the page is intended for a mother or for the service provider. And the tabs vary in this regard in that those that are long, as you can see here, are for the service provider. If they only go partway down the page, about half, a third to a half, you know that this is for a mother. And you'll see examples of this as the presentation proceeds. Here again is the color coding. So light purple is mother's wellness and self-care. The aqua is the mothering role. The red, cherry red, is understanding mother's mental health. This will include both risk factors and prospective factors, the kinds of things to look at as we work into the green section, thinking about assessment and screening. Interventions and treatment are blue. Supporting recovery is a fuchsia. And the community action section is in yellow. Long sidebar is for service providers like yourself. Short sidebar is a worksheet or a piece of information intended for the mother participants in your work. Here's an example from Understanding Mother's Mental Health, and you see that the bar goes all the way down the right-hand side of the page. So this is just something for a service provider to read and know a little bit about what some are the protective factors for mothers. So the examples here are positive attachment to a caring, consistent adult in their own early life. Solid sense of identity in their particular personality, kind of do they know themselves and how do they see themselves? They have a basic self-worth. Do they feel that they want things to get better in their life and they're deserving of things to be better? Do they have some self-care habits and strategies? What's their capacity to hold on to emotional optimism? Identified roles and responsibilities in their life, flexibility in their coping strategies, and a willingness to seek out social supports even if they don't have them currently. So this is not a sheet that you would hand out to a mother, but this would be something that would get you thinking about, how you might work with a woman and how you might think about her particular situation. Do you see those protective factors in the case or not? Here's another example from the same section for a service provider. You'll see that, again, although it's on the left-hand side, it goes all the way down the page. And again, what are protective factors for the children of mothers that you're working with? Here's an example from the cherry red section. You'll see it's short, tab on the left-hand side, and it says mother. So this means that this is something that you might use in your work with a particular mother participant. Now, sometimes these are things that would be explained, and then mom would be encouraged to fill it out or review it herself, or take it home and fill it out later. Some of it's something you might do with her in the center you're working in. Other things might be just that actually you do read it, but you don't think it's appropriate in this particular setting or this particular woman at that time to give her the form to fill out. But you would have the questions that then you might ask her just verbally, sort of in your interaction with her. And again, we encourage people to use this as they see fit. This is not considered a whole program where you have to do everything to the last sentence or every single page. You might decide that only 2 of these exploratory questions are appropriate for your initial sort of discussion with this particular woman. And again, we encourage you to use it as fits your setting. So let's go through the different chapters. The first one is on mother's wellness and self-care. Well, what do we really mean by that? Well, here's an example. Again, short on the side with the word mother. This is something you would go over with a mom. Well, many women are so focused on their infant and their children that they really sort of neglect their own physical well-being. In fact, They just say, I feel awful, and they're not really able to identify how they feel awful. So sometimes just even beginning at a body level to identify on a chart like this, do they have these particular symptoms? Headache, tiredness, dizziness, breathing problems, for example. And you'll see at the bottom we have other. So that's where the mom can fill in her own particular sort of physical experience that she's concerned about. And does it occur daily, weekly, monthly, or just sort of once in a while? People have said, what do I do with this sheet after someone fills it out? Well, sometimes it's just an aspect of self-awareness for that woman, get her thinking about that her health really has to be an important consideration along with her children's needs. It may even be something she's able to take into a medical care provider, like a nurse practitioner or walk-in doctor if she doesn't have a regular family physician. Again, people are encouraged to use these resources creatively in the ways that they think will be most useful in their center. Here's another example for Mother's Wellness and Self-Care that's actually specifically about preparing for their medical appointment. Again, it's not particularly amazing or sophisticated, but it's meant to just sort of remind us that either on this sheet or on a card that there are things that when they go in to see the doctor, which may be an appointment they've waited a few weeks for and is actually for the baby's checkup or immunization needles, they may have things that they want to tell the doctor about themselves. So what do they want to tell the doctor or the practitioner, and what do they want to ask the doctor and practitioner? There may not be time in that given appointment for all the things on their list, but there's no reason that the list can't be left with the doctor for placement in their file and consideration when they're able to get in another time. What about the kinds of things we think of as really critical to mood and thinking regulation that people go, yeah, I know that? Well, we all know what are some of the things that help us feel better physically and emotionally, but it's hard to always do it, isn't it? Particularly when you're parenting young children. So this sheet is meant again for use with a mother participant and is just titled, There's Nothing Like a Good Night's Sleep. In this, we're just getting people to begin again to ask themselves questions, to think about what their sleep habits are. Again, are they always the same? Does it vary from night to night? And can they begin to see any of the kinds of issues that may explain why they're having difficulty with sleep, either starting to fall asleep or staying asleep or feeling rested the next day. So very simple things, but where do I sleep? Who else is sleeping with me? What's their sleep like? Did I have a sleep style before I was a mother, and has that changed? Do I have a routine for sleep? Have I ever taken medications in the past to help with sleep, or am I, taking medications now? Sometimes people focus very much on that their sleep's disrupted with young children, but really, if you inquire, their energy and function in the daytime is still adequate for them. It's not ideal, and they do feel tired, but it's not interfering with function. Balancing needs and saving energy. Very, very important for mothers, but very difficult to do. This sheet is intended as something that you could photocopy or even enlarge and then cut out that particular woman's example of some things she could do that would actually be looking after her own needs as she looks after her children's needs. Very simple things. Might be that when another family member or partner gets home from work, that they have an arrangement that mom has 10 minutes with a cup of tea at that time. Not hours and hours, something realistic to their situation, but that after the new family member comes in and feels settled in, that there's a little bit of protected time for mom to kind of collect her own thoughts, just sort of prepare for what she wants to do in the next few hours. Simple things like that. And again, deliberately not a lot of direction, just a few examples, because we want the content of this to come from that particular mother, from her particular background and situation, working with you. Second section or chapter is what we call the mothering role, and this is where we really try to address what some of the typical but still potentially stressful adjustments are when you become a mother. Certainly many people talk about what it's like to become a parent for the first time, but each child brings their own particular sort of challenges, and it occurs at a certain point in a family's life, so it may be different from one child to the other. So here we have, again, the bar, the aqua bar goes all the way down the right-hand side, and it's titled Service Provider. So this is meant for something for the service provider to think about as they look at working on attachment development. And this is just simply a sheet that talks about the 4 patterns of attachment that research has demonstrated. Here's another sort of way of thinking about attachment development for the service provider and some sort of classic resources. And the 3 most important times for mother to respond to her baby's crying are when they're sick, when they're hurt, or when they're very upset. So it brings home that point that attachment is really who do we go to in points of distress. And if we've had someone as an infant or a young child to go to in distress, it means that we're probably going to be starting to create some of that security that's really important as life sort of goes forward. Doesn't mean that everything is perfect, but it does mean that it's about points of distress. Some care providers and some mothers worry that attachment means that mother has to perfectly respond to her infant or child's needs at all times. This is not the case. We're talking about points of distress being particularly important and bringing that point home to the service provider. Here, though, is a sheet that's related to attachment, which is just some ideas and information, some bullet points to discuss with women. So if you're working with mothers in a group, this might be something that you just verbally throw out. You might put it up on a flipboard if you're working with them. You could do this in a telephone support session with a mom and just sort of go through when she says, I'm worried that I'm not bonding with my baby. These are some, truths in attachment work with children that's sometimes helpful information. It's tried to be conveyed at a very sort of middle of the road language and educational level, but again, you may find you need to tweak that or adjust that in your language for the setting that you're in and the community of women that you're working with. Here's some basic developmental information in the mothering role, and again, short bar on the left-hand side, titled Mother, so we know this is meant to be used directly with mother participants. What babies have to say, what are the normal development and social cues at various ages. Another example would be how to identify supports for a mother. Really, even by being in the toolkit, it's demonstrating this is an important part of adjustment to mothering for almost all women. Here's a very simple graphic from the mothering role for you and your children, and it's called a support map. Again, you can photocopy this and blow it up, make the circles bigger, and you can use it in a variety of ways with women. Generally, we talk about the center being the woman herself and her children, but sometimes women may say, actually, I feel like there's other people in the center with me. And again, there's no one way to use the resource, but we try to have women identify who else might be in their circle of support, and then even talk about how close in they are now. Is that where they want them to be? Would they move them in or out? Are there other circles that they would add? Do they feel overwhelmed by support, and they want to be able to sort of control that a bit more? So again, it's meant to use this resource flexibly. These are not the only pages within these sections. These are just examples of the kinds of resources within each of these sections. So section 3 is understanding mother's mental health. So we're beginning here to think a little bit more about symptoms, or at least about protective and vulnerability factors. So here's a wheel, again, that's meant for the service provider to think about what are the kinds of things that we look at when we're trying to understand a mother's current mental health or her risk of mental health challenges. So you can see we have things like thinking style, self-worth and value, communication, coping skills. These are all things that are just helpful for the service provider to think about with that particular woman. Short tab on the side labeled mother. So this is in the cherry red factor, chapter 3, understanding mother's mental health. And this is risk factors for pregnancy and postpartum mental health problems. So women will often ask and say, am I going to get postpartum depression? Like, I think one of my aunts was depressed. What does that mean for me? And here is some very basic information at a community level for things to consider that may be risk factors. Again, not predictors of illness, but things to be considered. When we look at causes and contributions of illness, one of the things that we think about are, and a common term in mental health practice is the biopsychosocial origins of mental health problems. So we've tried to interpret this a little bit for service providers and mothers to say, well, what are biological factors? Well, sometimes it's genetic, inheritable kinds of symptoms or illnesses from our birth family. Our temperament as a child, kind of and an infant, our nature, you know, some people are naturally socially outgoing, other people are quieter and more naturally introverted. That tells us a little bit about kind of the biology of our nature as a person. Doesn't necessarily, again, confer illness, but just as a description. Substance use that could affect brain function. Is that current? Is that past? These are all things to sort of bring in and have a woman identify what some of her biological risk factors might be. Similarly, psychological factors, so how our mind understands and interprets experiences, including some aspects of our interpersonal life, but really this is about how we feel inside particularly. The social factors of the biopsychosocial factor have to do how we experienced ourselves in relation to other people, and this may be people in our family of origin, or it may be people in our life now, maybe our experiences in high school or in the workplace. It can have a broader meaning in terms of how we feel within our race and our culture or ethnicity. Are we a newcomer? How does that color our experience? And again, no one factor is associated with health or illness. They're all descriptors that are part of creating a kind of a picture of the biopsychosocial profile of that woman. Should the mom fill in this sheet, this is sometimes something actually helpful for them to take if they were to go to a formal mental health assessment appointment. It's information that they've already reflected on and demonstrated that they have some insight into what's going on for them. Signs and symptoms and diagnostic possibilities are included in the toolkit resource. Now, many people debated this and said, well, if this is not for mental health care providers, maybe this is outside the scope of practice. But we consider this a model of mental health literacy. If bad information is available online to people sort of every day, we thought that it was helpful to talk about what are the commonly described signs and symptoms of different kinds of illnesses, just as a point of community education. If a woman comes back from a mental health assessment and says they think I may have bipolar disorder, it could be helpful for the service provider to have a quick description of what some of the features of bipolar disorder might be. And is she seeing that in her center and how this woman is experiencing her day, herself, and influencing how she's parenting or coping as a mom, for example. So again, signs and symptoms, here's for the service provider. Tells a little bit about what mental health workers look for when they're doing an assessment, what kinds of things we need to be aware of. Increasingly, we're looking that we want in the promotion of mental wellness, we really want the general population to know as much about mental health and the things that contribute to it positively, the things that can bring risk to it, as we would to basic safety protocols for riding a bike or illnesses to sort of be on the lookout for. So we like to all know what a fever is, and that a fever may, if it's continued or is too high, is a sign sort of something that might need to be further assessed. Similarly with mental health problems and mental health symptoms. There's information here like changes in appetite and food habits, loss of interest in the usual pursuits, changes in thinking and emotional control. So if you remember Jody, one of her things was that she'd previously been very tried very hard to be good, to get along with people, to please them, to not create any difficulty. Was finding herself suddenly explosively angry, the opposite of how she saw herself when she was younger. She saw herself as shy, now she found herself aggressive in certain social situations. This is a change for her and a kind of loss of emotional control by her own sort of description. Again, under signs and symptoms and diagnostic possibilities, how do you define your mental health issue? Well, people say, I hear about blues and postpartum depression, what's the difference? Well, here's a description for the mom herself. So an example would be, what's a postpartum anxiety disorder? Well, sometimes you're not sad, but you're worried and tense. Ordinary worries come and go, but in this case you can't reason with yourself. The worry stays. Generalized anxiety is when you worry constantly and all worries seem big. So there's no sense of like, this is a minor problem and I'm a little worried about it, this is a big problem and I'm understandably worried about it intensely, or worried about it a lot of the day. Panic disorder is when your anxiety comes in your body suddenly and causes your body to overreact. Symptoms such as pounding heart, shortness of breath, trembling and tingling, and difficulty concentrating, a sense that you're going to be sort of overcome and not be able to sort of function in the moment. Goes on to describe other illness categories. And again, these are just examples of what's in Chapter 3, Understanding Mother's Mental Health. What about assessment and screening? That's Chapter 4. Well, that's our green chapter, and again, you'll see a short tab on the side with mother. Here's a mom's checklist for herself. Very simple, not something she scores, something for her just to start thinking about, am I having all or just some of these experiences? Is it all the time, or is it only occasionally? Also included is a formal screening test called the Edinburgh Postnatal Depression Scale. This was first developed in England by a doctor interested in postpartum depression. It's been used all over the world in remote settings, various cultures, and found to be a pretty good screen, not a diagnosis, but a screen for mental health problems in a new mom. Chapter 5 is about interventions and treatments, and you're going to say, but I don't provide interventions or treatments. Well, you'd be surprised, because one of the very important interventions in mother's mental health problems is social support and education and emotional outlet. And we know that these things are provided by CAPC and CPMP programs all across the country every day, and by many other settings where service providers support young families. So here would be an example for a service provider of something in Chapter 5, the intervention and treatment. Try and create an open and accepting atmosphere for discussing the adjustment to motherhood. Normalize the experience and expectations of mothering. I can't begin to say how important this is. Women in their own minds, in what they see portrayed in the media, sometimes from what other people tell them in a well-meaning way, really often are not the reality of parenting or mothering. And we need, as a community, to be very clear about what is essential in mothering infants and young children. How do people prioritize? What are the ways in which life doesn't always run perfectly, or you don't always know exactly what to do as a mother? Because a big source of anxiety for many new mothers is feeling like they have to meet all of these expectations of everyone all the time. Another example would be in Chapter 6, called Supporting Recovery. This photo, as you know, was taken from the popular press for the unfortunate experience of a young mother named Britney Spears, who was a celebrity and an entertainer, but was speculated to have significant mental health problems in the wake of the birth of her 2 children. But as you'll remember, despite having all kinds of resources at an economic level, and perhaps in some ways living a sophisticated life, or so it seemed, she struggled with all of the adjustments to her life before and her life as a mom. So how do we support the recovery from a mental health problem of any mother? Well, here's something a mother can do herself, which is really look at tracking her symptoms. So what's the situation or experience? What are her thoughts? Does she have any body symptoms? What are her behaviors or coping response? And how does that work for her? Because one of the things is helping her identify what helps and what tends to not help, or what hinders or makes things worse. So this is a very simple, again, flexible sheet. She may need to connect to formal mental health services, and this is meant just as a generic template for service providers to know what are the kinds of things that you might look at, where would you go. Again, in a given area, there may not be a mobile crisis line, or there may not be an addiction service. And you may need to cross that out and think about, is there an alternative to that in our community, or is the woman left to do a number of self-management or self-directed kinds of activities. But this is just sort of a scheme from which it's a jumping off point to think about what would I do in each of these instances. So concern for the woman's mental status versus family violence. What about community action? In the toolkit, we have the examples from our own advisory committees of the kinds of community action and program development that's really meant to support mothers' mental wellness and support the development of young families. In no way are we community activists or experts in this field, but we felt it was important to include this section to acknowledge that the creative aspect of programming really suited to your community, that's a passion and a commitment from service providers, needs to be acknowledged and encouraged, well beyond sort of necessarily formal systems or services. Well, what are the lessons we've learned in the development of this toolkit? Well, that it's really hard to write a book by committee, but also that, you know, by bringing in many diverse perspectives, that we realized that there were some very basic approaches which we hope we've captured in the resource book, both to support service providers in the sections they would read or use, and in mothers' work directly. Very simple worksheets and ideas that are really the foundation of maternal mental health. And again, can be adapted, used or not used as you see fit, you know, to your particular woman, to your particular community and situation. We recognize, as I said at the outset, some of the limitations, and so one important lesson is that some of this material in the resource or in the training materials might very well need to be adapted and expanded on for particular populations and communities. We do see windows of opportunity, though, you know, that are really important to us as a country, important to us as communities, as to how do we really begin to support mothers in particular, but families ultimately, so that children grow up in a really strong, well and emotionally resilient way, so that they become even more productive members of our community and we grow as a country. And these are, you know, sometimes opportunities that are not easy to see, such as on this visual where you're looking through multiple windows to see something that looks like it's really far away. But sometimes that has to start with an individual action with an individual mother. And from small things we build larger endeavors and we build communities. The path we're on, as we said, is that we're working very hard on developing training materials to accompany the toolkit resource, and you'll hopefully be hearing more about the dissemination of the toolkit resource in your area and opportunities to access the training materials either remotely through video or other modalities, or to attend an in-person training. Here's our contact in Halifax. That's our telephone number and our fax, and you'll see my current email. Hopefully, if you're looking at this video long after that email's not current, the phone number still will be, or you can ask for the new number for the Reproductive Mental Health Service in Halifax, which may be able to direct you to what's become of the toolkit resource, or how do you access it remotely on website, what kinds of training resources are there in your region? Are there people that can provide training or support? Thanks very much for your time and attention today, and we hope that you'll look at some of the other modules that we have in the Maternal Mental Health and Mother's Toolkit series.